Morning.
Good morning, David.
Thanks for your time this morning. I know how busy you are, so I'm going to keep this very, very simple. Unfortunately, within the past few days, we've lost two key people as a result of some heart conditions they had. Now, we all know that as we speak currently, Kovanoshi doesn't even have a cath lab. That could have saved the life of this 47-year-old emergency physician. So one thing that we need to do for ourselves as a people is preventive medicine. Now, when it comes to preventive medicine, first of all, explain to us what preventive medicine is and tell us from your own cursory view how well we are doing as a people when it comes to preventive medicine.
Okay, thank you very much, David, and good morning to everyone. So, when we talk about preventive medicine, and first of all, my condolences to all the family of the two gentlemen who have unfortunately lost their lives. And we are praying that this doesn't happen again. And not just to them, to all the others who may not be known in Ghana widely as these two gentlemen, but have also along the way lost their lives. So preventive medicine, really we're looking at preventing disease, disability, premature death, through various measures. So these measures could be health screenings, regular checkups, vaccinations. So anything that you want to do to prevent anything unfortunately happening to you, your health, your body. That's basically preventive.
Now, when it comes to Ghana or Ghanaians, where are we? How well are we doing?
Ghanaians, we have the saying in Chi that any time back. So we don't want to go do the labs. We don't want to search. We don't want to check if we are doing well or if there's a problem, because we're scared that we might find a problem and then all that comes in. Because you see, most of the things, the conditions that lead to someone having a heart attack, they don't usually come with symptoms. So if somebody has a high blood pressure, they might be walking around. There are so many times I've seen patients, somebody's blood pressure that normally should be around 120, 80, sorry. Somebody would come to the clinic looking very well, and their blood pressure is like 200 and something over 160 or something, 110. And they don't know. Or somebody's blood sugar, you check, and even the glucometer or the machine that we use to check the blood sugar, we prick your fingertip to check, reads high, like HI, meaning it's like way above the limit the machine can even record. But we don't like to do checkups. And that is the problem, the huge problem we have in Ghana. I would not say that these two people or the other people who have passed, it was necessarily because they did not do checkups, but generally Ghanaians don't like that.
So as we don't like that, we want to get the education and then get to practice it. First of all, what do we need to do when it comes to preventive health? You talked about, regular screening and stuff like that. How much role does exercises and the right diets and others play in there? What goes into preventive medicine? Give us some specifics and tell us how we can practice it.
Okay. So first of all, to everyone listening right now, my question is, do you know your blood pressure? Do you know your blood sugar, like what it has been in the past 1 month or in the month of, we're in July now. Have you checked your blood pressure in July? Or even June? Let's go back. Do you know what it is? And then let me just ask, and then I would add on to the advice. How many of us like to exercise, especially those who do sedentary jobs? So if I talk about sedentary jobs, you work at the bank, you have a business, a shop where you sit in almost every day. You work at a radio station, you are constantly sitting. You work in an office, you are a big person. How physically active are you? So typically, you would get, especially, let me just use the gentlemen. They wake up in the morning, sit in their cars, drive straight to the office. They park very close to the office, so they just walk in, go to the office, sit down, a whole day of meetings, maybe online, people coming to see them, sitting there. Sometimes even during lunch hour, they order for the food to be brought in. They take lunch in the office. If they need to talk to a colleague, they just pick up the phone instead of walking to the person's office. If there's even like an elevator or an escalator in the building, they use that instead of using the stairs. They finish, close from work, sit in the car, drive home, have the food served to them, finish eating, watch the news on TV or some football match, go straight to bed. And that's how the cycle continues. And no physical activity, at least for every individual. Healthy, we do have some provisions for children, for the elderly, for those with some very bad conditions or disabilities. But ideally, every person should get at least, when we talk about being physically active, at least 150 minutes per week of being physically active, moderate intensity. So we talk about every day at least 30 minutes. Can you do some brisk walking? Yes, we may have the excuse that we don't have the time, but you can break it down into 10 minutes. 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evening. It also does not mean that constantly. You can fix it into your day. So if there are stairs in your office, and I know at Love FM, there are stairs there. So you can choose that maybe during the day, I'm going up and down those stairs about 10 times or for about 5 minutes. And then I decide that even right now that we're on the call, I'm actually pacing up and down. That's part of my exercise because sometimes I work from home. So I'm like, okay, let me just walk up and down whenever I get a call. So that is also part of the exercise. Daily chores in the house for everyone, scrubbing, sweeping. It's not that, yes, I have money, I have a house help, so I shouldn't do anything. See it as exercise. So all these count as exercise, and sometimes we decide, okay, it's only on weekends that I'll go to the gym, and then after you eat a huge bowl of fufu, so you've sort of, I wouldn't say negated, but it doesn't, you don't get much effect from it. So physical activity is very, very important, and we need to make a conscious effort to do that, and not only wait for the Love FM fitness walk. That is very good, but can we do a fitness walk almost every day? That helps us a lot. When we go to church, dancing, praises time during church is a form of exercise. So use every opportunity. You are going to, let's say, the mall. Can you park some place further away, maybe one end of the mall, and walk to the shop at the opposite end instead of going to park very close to that part of the. So let's say you are going to Melcombe, so you park at the ShopRite part of the mall, and you walk all the way to Melcombe. That is exercise. So we need to be physically active. Then we look at our diet. What are we eating? Now we are the influx of takeaways, the fried foods, like the fast foods. It's becoming a lot, and most of these fast foods don't use because they need to be tasty. Use a lot of spices, artificial spices, which have a lot of sodium, so meaning salt in it. You might not taste the food to be that salty, but the sodium is in there because of the artificial spices. Vegetables. We don't take a lot of vegetables. We rather want the rice, the banku, the fufu, but we don't want a lot of vegetables in our meals. But ideally, every day you should take a good, healthy amount of vegetables. And the fruits also, very important. A lot of us like red meat, but that constantly taking red meat is not good for you. So you go and buy the fufu and there's a lot of red meat on it. Rather choose to do fish or skinless poultry, so chicken, but the skin of, because sometimes there's a lot of fat under the skin. We like to drink sugary. Now the influx of sugary drinks, a lot of sugar is just sugar, water, color. and we're taking that a lot. Every party you go to, can you decide that I'm cutting down on that maybe once in a month or so? I would rather choose when it comes around their serving, can I please have water? That would rather help. Or pure fruit juice. But even with that, you also want to cut down and not constantly be doing that. So the chocolate drinks we take, some decide to even put extra sugar in it. So all that does not help us. The amount of salt, when we are born as children, we don't start eating salt or sugar. It's an acquired taste. So the same way our parents start feeding us as we are growing into toddlerhood and whatever, they start introducing sugar and salt. The same way you can start reducing the salt and sugar in your diet. And I've actually done that size. And when I go out once in a while to a restaurant with my family, we are all like, this food is too salty. It's not because probably everyone in the restaurant might think it's fine, but because we have trained our palate to know that we don't want too much salt or too much sugar in our food. And you can do that. Habits develop over time, and you can just become used to it. And then we are talking about, again, aiming for a healthy weight. So check your weight. When was the last time you checked your weight? We don't use our eyes to look at someone and say this person is overweight or this person is slim, so they look okay. We compare your height with your weight. So what's your BMI? Is it in a healthy zone? So what is your weight? And then your cholesterol. So now we're coming to your labs. You need to check, because it's not only people who are overweight who might have high cholesterol. There are people who look slim but may also have high cholesterol. So there's fat in your blood vessels that can go and block the blood vessels, the clot can travel, can easily kill you at any time. And then if you have any diabetes, hypertension, please make sure that you're constantly taking your medications. You are not mixing it with any concoctions or herbal things that will make it worse. Listen to what your doctor says. If you feel that maybe this person, this health professional I'm not really comfortable, change it. Make sure they are always in the right range. Please make sure you are checking your vitals, your labs. For everyone who may not have any diabetes, hypertension, or anything like that, you can every birthday, instead of going to do that, well, you can do anything you want to do, healthy or whatever, in a healthy way. But please set aside some money. If somebody wants to gift you something, say, I want you to pay for my labs. Set aside some money and plan that every birthday I want to do a checkup. I actually do that with my whole family. Every birthday, we all go to do it. When it's your birthday, you go and do a full lab checkup. Check my cholesterol, my kidney function, my liver function, my blood sugar. It's actually a test that gives you an idea of blood sugar over 3 months or 3 month period. So all these are very important. Then we look at our lifestyle. You get enough sleep. People say sleep is for the weak, sleep is for the lazy, but sleep is very important for you. As adults, at least we need 7 hours of sleep every day. Yes, you may be stressed, work deadlines, but you need to set goals. Your health is important. If you get a stroke, if you get, fortunately, a heart attack and you die, the work will still be there. So you need to be able to get enough sleep, to be able to switch off your phone or put your phone on no disturb mode or on silent or no calls whilst you are sleeping, except maybe if you are a health professional, you're supposed to maybe supervise some people, and so you're expecting a call. But you need sleep. You need very good sleep, at least 6 hours every night. It's very important because you wake up refreshed, your body gets the time to rest, and you don't get all these complications. Stress, a lot of us are stressed. Luckily now it's a bit better in the country, so the stress, but work will always stress you. Family might always stress you. A lot of things happening in your life, relationships, whatever might stress you. But you have to ask yourself, can I do to relax? Some people like to go onto maybe social media, find some funny skits and laugh, and they feel refreshed. Some people like to go to visit, call family, friends, chat, meet up, go to church, read Bible, or go to any religious activity and find people to talk to. How do you relax? Leisure activities in a healthy way helps you to relax. Sometimes exercising actually helps you to relax. So make time for your family, make time for your friends, time to relax. It's very, very.
Doc, you know what? I wish we had ample time so we can go on and on and on for me. But time is not our friend right now. So let me ask you one final question. In all that you're saying, which of course I have learned so much, I ask myself, how feasible are these things when it comes to, for example, the dieting and the exercising? Are they expensive? And how do we find time of our busy schedules to do all these things? No, please reposition yourself for us. There are breaks on your line, please. Thank you. Not. There are still breaks on the line. If you can move a bit from where you are, let's see if we can get a better connection to you.
I don't know whether it's better now.
Oh, no, so bad. Let's try one more time. Just move a little. Let's see, Doc. Please indulge me.
Okay. Is it
better now? Yes, it's better now. Don't call her back. But you know, she said a lot of